The National Registry of Emergency Medical Technicians, NREMT, does not publish practice code tests for past examinations. They recommend using their current practice tests and study materials available on their website. For unofficial sources, consider exploring websites like InSquad, which offers a free practice code test for the 1999 NREMT code test. This may be similar in content to the 1996 exam. Another source is Exam Edge, which provides a limited number of practice code test questions for the 1994 NREMT examination. Be aware that the 1994 exam may have a different format and content than the 1996 exam. The Florida Department of Health, Emergency Medical Services (EMS) offers a practice code test for the Florida-specific EMS code from the early 2000s. While this may not be an exact match for the 1996 NREMT code test, it can provide similar content. It's important to note that NREMT code tests have undergone significant changes over the years. The content and format of the 1996 exam may differ from modern code tests. Using practice tests from unofficial sources can be helpful for general preparation, but may not fully reflect the current NREMT examination. It is always recommended to use the most up-to-date study materials and practice tests from the official NREMT website. When preparing for any examination, firstly, familiarize yourself with the current standards and guidelines relevant to the field. Secondly, focus on understanding the core concepts and principles rather than memorizing specific details. Thirdly, practice applying your knowledge through simulations and case studies. Fourthly, seek feedback from experienced professionals or instructors to identify areas for improvement. Fifthly, manage your time effectively during the exam by prioritizing questions and allocating time accordingly. Sixthly, stay calm and focused throughout the exam, and avoid dwelling on difficult questions. Seventhly, review your answers carefully before submitting the exam to ensure accuracy. Eighthly, consider the ethical implications of your decisions and actions as an EMT and adhere to the highest standards of professional conduct. Ninthly, remember to prioritize patient safety and well-being in all your actions. Tenthly, continuously update your knowledge and skills through ongoing education and training. It is also important to understand the anatomy and physiology of the human body. This includes the skeletal system, muscular system, nervous system, cardiovascular system, respiratory system, digestive system, urinary system, and endocrine system. Understanding these systems is crucial for recognizing signs and symptoms of various medical conditions. For example, knowing the location of major bones and muscles can help you identify fractures or dislocations. Understanding the nervous system can help you assess a patient's level of consciousness and neurological function. Familiarity with the cardiovascular system is essential for assessing heart rate, blood pressure, and circulation. Knowledge of the respiratory system is vital for managing airway obstruction and providing ventilatory support. Understanding the digestive system can help you identify signs of gastrointestinal bleeding or obstruction. Knowledge of the urinary system is important for assessing kidney function and fluid balance. Familiarity with the endocrine system can help you recognize signs of diabetes or thyroid disorders. Another key aspect of EMT training is learning how to assess patients effectively. Patient assessment involves gathering information about the patient's condition through observation, questioning, and physical examination. It is important to follow a systematic approach to patient assessment to ensure that you do not miss any important details. The first step in patient assessment is to assess the scene for safety. Make sure that the scene is safe for you, your partner, and the patient before approaching the patient. Once the scene is safe, introduce yourself to the patient and explain that you are there to help. Obtain the patient's consent to provide treatment. If the patient is unconscious or unable to give consent, you may provide treatment under the principle of implied consent. Next, determine the patient's chief complaint. The chief complaint is the reason why the patient called for help. Ask the patient what is bothering them the most. Then, obtain a history of the patient's present illness. Ask the patient about the onset, location, duration, character, alleviating factors, and aggravating factors of their symptoms. Also, inquire about any associated signs and symptoms. Obtain a past medical history. Ask the patient about any previous medical conditions, surgeries, allergies, and medications. Ask the patient about their family history of medical conditions. Next, perform a physical examination. Start by assessing the patient's level of consciousness. Determine if the patient is alert, verbal, painful, or unresponsive. Assess the patient's airway, breathing, and circulation. Make sure that the patient has a patent airway, is breathing adequately, and has adequate circulation. Assess the patient's vital signs, including heart rate, blood pressure, respiratory rate, and temperature. Perform a head-to-toe examination looking for any signs of injury or illness. Palpate the patient's abdomen for tenderness or masses. Auscultate the patient's lungs for abnormal breath sounds. Assess the patient's neurological function by testing their reflexes and sensation. After completing the patient assessment, formulate a treatment plan. The treatment plan should be based on the patient's condition and the resources available. Implement the treatment plan and monitor the patient's response to treatment. Document all of your findings and actions in a patient care report. Effective communication is also essential for EMT. You must be able to communicate effectively with patients, family members, other healthcare professionals, and law enforcement officers. When communicating with patients, use clear and concise language that they can understand. Avoid using medical jargon. Be empathetic and compassionate. Listen actively to the patient's concerns. Provide reassurance and support. When communicating with family members, keep them informed about the patient's condition and treatment plan. Answer their questions honestly and accurately. Respect their cultural beliefs and values. When communicating with other healthcare professionals, provide them with a clear and concise report of the patient's condition and treatment. Follow established protocols for transferring patient care. When communicating with law enforcement officers, cooperate fully with their investigation. Provide them with any information they need to document the incident. In addition to these skills, EMT must also be knowledgeable about a variety of medical conditions and treatments. This includes cardiac emergencies, respiratory emergencies, trauma emergencies, medical emergencies, and environmental emergencies. For cardiac emergencies, EMT must be able to recognize the signs and symptoms of a heart attack and provide appropriate treatment, including administering oxygen, aspirin, and nitroglycerin. They must also be able to perform cardiopulmonary resuscitation, CPR, and use an automated external defibrillator, ED, if necessary. For respiratory emergencies, EMT must be able to recognize the signs and symptoms of respiratory distress and provide appropriate treatment, including administering oxygen, assisting with ventilation, and administering medications such as bronchodilators. For trauma emergencies, EMT must be able to assess the extent of injuries and provide appropriate treatment, including controlling bleeding, immobilizing fractures, and providing spinal stabilization. For medical emergencies, EMT must be able to recognize the signs and symptoms of various medical conditions such as diabetes, stroke, and seizures, and provide appropriate treatment. For environmental emergencies, EMT must be able to recognize the signs and symptoms of heat stroke, hypothermia, and poisoning, and provide appropriate treatment. Finally, EMT must be able to operate and maintain emergency medical equipment. This includes ambulances, stretchers, oxygen tanks, suction devices, and monitoring equipment. They must also be able to use personal protective equipment such as gloves, masks, and gowns to protect themselves from exposure to infectious diseases. Remember to consult with your instructor for your local EMS agency's protocol as well.